So I'm going to talk about AI, and it's AI-driven spinal cord stimulation, how you can harness the power of artificial intelligence to achieve deeply personalized chronic pain therapy.
Artificial intelligence means a lot of different things to different people. The idea here is trying to look at the ability to collect a lot of data on pain patients and to see if we can use algorithms that have been developed by IBM in this situation and do a couple of things with it. One, predict patients' pain. So think about the implications. If I can predict where a patient's pain might be in 24 hours, then particularly if it would predict that it's going to be bad, can I institute therapies that might alter that history or the natural history of the pain? So AI is starting to show us some real capabilities of that.
It's something that I've been working on with different folks for 6 or 7 years, and it got accelerated a bit during COVID. I think a lot of us were remotely monitoring patients and seeing how we could still be impactful to them in their lives. So this was an ongoing partnership. It was 2 studies from where this pool of data came and the patients I'm going to talk to you about. It's Navitas and the Envision studies. These were ongoing, multi-center prospective Boston Scientific trials that were enrolling patients who had spinal cord stimulators in place. These were somewhat longitudinal studies, if you will, and you'll see the digital data that was being collected and the idea of creating this biologic, if you will, ecosystem and footprint of each patient and how we might use that in thinking about how we care for patients.
In the one study we did, we could predict within 1 point what their pain would be on a given day or the following day. So that was, I think, kind of exciting stuff. The other part of AI, obviously, is taking large amounts of data and trying to make them more straightforward and more comprehensive and let us be able to, again, direct patient care that way. So what we're trying to do is using questionnaires, using just spinal cord stimulator data, things like Fitbit watches and other types of maybe sleep monitoring, take all that data, understand that these patients cluster into certain groups. What we saw were 5 groups, and then take that data and we can actually, by them feeding it to us over 6 weeks, we were able to give them daily recommendations of things they might do to try to access what we call better states, but just less pain, more effective mobility, better sleep, things like that. So trying to use AI. A book I like is Eric Topol's book on sort of how AI can be used to make medicine actually more human. You know, I think my intuition was always everybody wanted to use AI to get rid of the docs or things. That's not the goal here. So I think it's got some promise. I'm excited about it and looking forward to seeing where it can take us.
Now, I'll stop for a second just to say, I don't know how many of you guys have read Eric Topol's book about deep medicine and how AI can make medicine more personal again. And it's a fascinating read on this whole topic. I was always one who thought AI meant the dehumanization, if you will, of pain medicine. But I think that's unfair to AI. AI is just a tool, and it's a tool that we can use, I think, very successfully in our patients and in chronic pain states that way. So I'll sort of...
Yeah, it's probably going to be hard just to do it as an individual person because AI, by definition, is large data sets. I do hope, if it's done right, that it will let all docs have access to the ability to give better outcomes, because I think what AI and this whole technology can do, and what I'm most interested in, is sort of more patient-centric care, sort of more holistic care of the patient rather than just sticking a great shiny new object in them and a new widget, you know, trying to get back to sort of patient-centric care. So I do hope that's the goal, is obviously that all docs could have access to this type of technology and to use it to get better outcomes with their patients.
You think about it, what I've been telling you is you're collecting this data, right, that's being gotten for the patient, from the patient at home. It's using different now digital technology that we have, whether it's questionnaires, wearables, things of that nature. And it's allowing us to, again, use AI to have a better holistic understanding of the patient, which can then start a feedback loop with therapy recommendations and back to sort of these same tools that they're collecting, and to adapt them and use them for each patient to try to get the best outcome. And really, for me to think about it, it's to try to drive sustainability of the therapy over time. So I think we know we're really good at getting analgesia early in spinal cord stimulation after implants. And we also know if you keep them in a trial forever, they'll do well if they're as long as they're in a trial. And that's probably complicated why that happens. But we also know that a lot of patients who are just left at home with these devices, a reasonable number of them don't continue to do well over time.
I think one of the real focuses is trying to look at patient-centric care. Using a term, is about feedback loops. So the patient gives us data, we can integrate it using AI to see where they are, take that back then to the patient as recommendations that they can see, try to implement those and see, in the first cut of 76 patients, 84% of them were able to either have better pain scores or better quality of life measures or both. And so I think hopefully we can build off of that and sort of develop it more. But I think that's the main crux of it at the sort of 30,000 foot level.
And then we sort of tried to look at what are the holistic outcomes and patient perceptions that happen. And it was pretty interesting. It's 76 patients to date that we have data on. And you can see that 84% of them, and this really should say reported improvement in pain and or quality of life. So a lot of these showed improvement in those multiple domains that I showed you. It wasn't just one. And there were some patients who worsened and some who didn't change. But I think pretty strong evidence that this can work, that by sending these recommendations back and forth to patients and giving them tools to try to help them with their pain on a daily basis can be beneficial.
What we're trying to do there was build this, we call it a digital ecosystem for the patients, so that we understand that foundational level, not just for individual patients, but maybe our pain patients as a group. And so that's where we took so much data and fed it in, and that required patient interaction. So we did it as part of an ongoing study that was present, and it was really shocking. We were asking for daily feedback from the patients, so daily interactions for the patients, and 76% of them gave us daily feedback for 12 months. So it did require a lot of patient interaction, but it looks like patients are willing to be involved and engaged that way. But it will be a two-way street a little bit that way. The patient's giving us data that we can then give back to them.
I think a conclusion when you're first trying to collect all this data is that when you have all these multiple outcome domains, it's going to be hard and can often be really complicated to interpret that and know. And that's where AI needs to kind of come forward and help us.